Hello, everybody, and welcome. So happy to have you here with me today. And I love our topic today. We are going to be talking with the wonderful Miss Carrie Riker. And today we're going to be talking about how to run a membership in an insurance based model. So, really excited to share that with you. I mean, anyone, if you know my work at all, you know how passionate I am about helping you to create multiple revenue streams, right? And seriously, creating a membership within your practice, really, regardless of whether or not you're insurance based or cash based, is incredible. It is seriously, like, almost as good as cloning yourself in your business, right? So, really looking forward to sharing some insight with you on this wonderful topic. And my name is Leslie Bytel, and I'm a business strategist and mentor for health professionals. So, really passionate about helping my clients to overcome that sense of overwhelm that often comes with the business building side of creating a profitable practice. So, I help you to get out of overwhelm, streamline your strategies so that you can be very profitable and have a life, right? Get paid really well for the work that you're really put on this planet to do. So, with that little intro, let me introduce to you my wonderful partner here. And so, Carrie Riker. So, I worked with Carrie Riker in her business, gosh, for quite a while, right,
Yeah.
Carrie?
hmm
And yeah, and we can kind of share a little bit of that history with you. But really, I wanted to bring Carrie on because she has successfully implemented this strategy into her own business. And I love, when I can bring people on that have actually done it, right? That have actually been successful in the model that we're talking about. So, Carrie, would you like to say hello to everybody?
Yeah. Hey, everybody. Thanks for tuning in. My name is Carrie Riker. I live in the Nashville, Tennessee area. And I was fortunate enough to work with Leslie for, oh gosh, was it about 2 years, I think?
So,
And yeah, she really helped me launch my private practice, get it off the ground. I was stuck in a corporate job for years and with a long commute, and I was just ready to get into a private practice that was thriving. And an insurance model was a great way for me to quickly fill up my practice. But Leslie really helped me discover this membership and an alternate revenue stream. That way I can confidently leave that full-time job and start my private practice. And it started right at the beginning of COVID. And this
right.
program really helped it survive and get going during that time of year. And it's still that membership program has been in on a go for, oh gosh, at least a year and a half, I think.
Yeah.
We've been doing this. So
So
yeah.
that's what's really cool about it, guys, is it's an additional revenue stream. And I think one of the cool things that you're going to discover today after talking with Carrie and just kind of hearing how she put it together and her perspective and how she keeps it going, right? That's super important too. You're going to really learn it's not difficult. It really is not difficult. Like, all of these tools and strategies and the success, the ability to generate, additional revenue in your business is completely within reach. So that's what I'm really excited to share with you today. So we are going to talk about, how she's able to generate on average an extra 2K per month in her practice. And guys, this is cash, right? So the bulk of her private practice in terms of seeing clients in her business is insurance based, right? We're going to talk to her a little bit about her practice, what kind of patients she's working with, etc. But I do want to be clear that this is a cash add-on, right? Which is pretty cool. And we're also going to talk about how she moves clients into how she sells it, right? So what's included? We're going to really dish on, kind of behind the scenes, what's included, and then how does she position and sell this program to her clients? So that is all in store for you today. So give me a thumbs up or a yes in the comments if you have been looking for a way to, give me a little feedback. Give me some feedback. Give me on the comments if you've been looking for a way in your own business to create an additional revenue stream and or a membership program. I'd love to get some feedback going from you. All right. So let's jump in, Carrie. So I think what would be really super helpful is if you shared a little bit really about your business, right? The name of your business, the area of focus, all just kind of a little bit of background in terms of who you work with. And one thing that is intriguing, I'll just kind of put this out there. You're in an insurance model, but yet in your business, we decided to niche you down, right?
Mm-hmm.
And I wondered if you could speak to that a little bit. Because quite often in the insurance model, it's more typically more of a general practice. So I put a lot out there, but I know that people, our audience today is going to really benefit from hearing about your journey.
Yeah, absolutely. And so before I met with Leslie, I was a general practice. I wasn't niched down. I am a diabetes educator. And so I would see some of those clients a lot and get those referrals from doctors, which sometimes, a lot of times in my experience, they weren't patients that were compliant. And so when I worked with Leslie, what I found is that I really have a love and passion for GI issues. So I see a lot of clients with IBS or IBD, which often means, especially for my IBS folks, we're doing a lot of low FODMAP diet protocols. And so as most of you know, since you're dietitians, like that's a really complicated diet protocol. And so, I use Eat Love for meal plannings, and I was using that program before I met with Leslie and just offering it at a really low end cost and wasn't really utilizing it to its full potential. And so meeting with Leslie, she's like, why don't you do a membership and you can offer this at a higher price per month, like a monthly subscription, just kind of like we subscribe to Netflix. You're going to subscribe into this membership program for these meal planning opportunities. And so most of my practice is digestive diseases and that. I will see some sprinkles of like diabetes or heart disease since I am still a diabetes educator, but that's really where my primary focus on. So even in that diabetes world, a lot of them need carb counting too. And so offering this membership of meal plans has been so helpful for clients because I don't know about you guys, but as a dietitian, when you start off, you don't want to give them a meal plan. You just want to teach them, but that's not what people are asking for. They're asking for meal plans and they were going elsewhere to get them from people who aren't the experts. And so by utilizing a meal planning program from Eat Love, you can continue the education while also showing them like, hey, these are these are meals within your nutrition prescription that you could be using. And, a lot of people are stressed with trying to figure out what to eat and so that helps alleviate the stress off their plate. And it helps show me more like what they're eating and that too. So it's a win-win that we can build rapport and that, so it's a really great idea to implement alongside, insurance-based model, or even if you're not an insurance-based model too.
Exactly. Okay. So one of the takeaways then is that in your business, we did decide to niche down, and it was, do you think that doing that really helped your numbers? I mean, do you feel like, that's part of why you're so busy now? Like you're incredibly busy. You've got a really full roster. Do you think nipping down in the insurance model is, I guess, helpful?
Yes, absolutely. It's been so helpful because it helps streamline like my referral sources. I'll say, hey, I see this clientele. This is who I'm looking for. And so doctors know like this is the person for GI issues. So that's been really helpful. Also enrolling in different websites to be found as on the providers list has been helpful, or even word of mouth as well. Especially in the GI world, it's not like people are hanging out at a certain location, so that way getting that word out there through different website searches, or even social media. That was a huge change
Right.
for me too. I was able to niche down on social media, which has led to more exposure there as well.
Oh, right. I would imagine, like on Instagram. I always say rule of thumb, one niche per account on Instagram, right?
Yeah.
So it would be tricky if you had a general practice on especially on that particular platform. So basically it gives your entire business some focus rather than just being all over the place. And it also makes you more memorable, and it positions you as really being an expert in your particular area, all of which is super important as you plant your flag of authority, right? And kind of utilize that to really attract the clients that you're very passionate about helping. So I love that. So, okay. So everyone's clear. And just looking at the comments here, we've got Eileen. Eileen is definitely in for creating a membership. And we have Andrea. And she also is loving the idea of a membership. So you guys are definitely in the right place. And wanted to mention too, those of you that are going to catch the replay, of course, we'll keep the replay up so that you'll be able to access that later as well. So let's get into the nitty gritty in terms of what should we include in this membership program? Like, let's list out the different, features, so to speak, in terms of what exactly is included. And then let's talk about, how we came up with the pricing, right? Mm-hmm. So that everyone's clear on that part. Because I know that's been a little bit of an evolution for you in terms of pricing. So let's chat about that. So again, just to remind you all, the sessions in Carrie's model, for the most part, are covered by insurance, right? So this is an add-on, like a cash add-on. And I love that analogy that you made, Carrie, comparing it to like Netflix, right? It's really exactly what it is. And so what do we have included?
Yeah. So with this, I call it my accountability program. Mm-hmm. And so that way it's general based. So in case I do have somebody outside of GI issues, I'm not targeting that audience. So I just straight up call it the accountability program. So it's generalized. And what that means is that it's, I'm holding people accountable. So with that, basically they get a prescription-based meal plan. I use the program Eat Love. And so I'm able to put in their nutrition prescription, and they get the individualized meal plans. And I can look at their dietary food logs, and so that way I can help to make sure that they're staying on track. And, I have weekly check-ins with them. And this doesn't mean that I'm connecting by phone or anything. I do know that Eat Love has a messaging section on it, but I do use the platform Healthy as my EMR. And so I do communicate with clients through there, whether I send a general mass message to everybody enrolled in the accountability program, like, hey, here's some tips for this week, or here's a new recipe that I think people would like. So I can send a general weekly message through everybody through Healthy is where I message through. And then I also, take a look at everybody's meal plans, their daily logs once a week. So basically it's a meal plan, food log review, and some messaging.
Okay. And the messaging is through Healthy.
Correct.
Okay.
Correct.
And the meal plan is through Eat Love. And
correct.
We'll share a little bit more information on that particular platform here in just a few moments. So, yeah. So, okay. So we've got the meal plans through Eat Love. And if I'm, tell me if I'm on or off base here. I think one of the big advantages to this particular platform is the scalability, right?
Mhm.
So, because a lot of the times we get questions, well, how time consuming is this? Is this going to be, super time consuming on my part? And so, can you speak to that a little bit? Actually, you know what? Hold that thought. I'm getting ahead of myself. So, let me finish summarizing the inclusions, and then let's go to how much time it takes. So, we've got the meal plans through Eat Love. We've got the communication through Healthy in this case, and other EMR platforms have that capability. Carrie just happens to pick Healthy, which is an awesome choice. You're sending weekly motivational kind of messages, right?
Mhm.
And that's through Healthy. And then you're doing food journal reviews, right?
Mhm.
Is that through Healthy as well?
So that will be through, most people will choose to do Eat Love since they're eating those meals. It's
Got
easier to just use Eat Love. Some of them, I do have a random few that will use another platform, like Healthy has one built in, so they might use that one, but that's rare. Most people choose to do the Eat Love logs.
Okay. All right, good. So did I forget anything?
No, that's it.
4 things. Okay, cool. Awesome. And then, so yeah, let's talk about the price and then the scalability, like how time consuming this is. So, how did we come up with, we got to think back, right?
Yeah, it's been a while.
Time ago. How do you recall that we came up with that pricing? And did we start at 97?
You know what? We did start at 97. I think before we increased it, I was offering it at maybe like $20 or $30 a month,
Okay.
something low. And you're like, Carrie, we can really increase that. And I was like, well, can we? And then she's like, you're like, just try it. And sure enough, people are willing to pay that price because it's personalized. And so I think we were looking at one, like the cost of the platform, and then two, I think the time that I'm spending per month,
Right.
it contributed into that factor as well.
Exactly. Okay. So that's amazing. I do remember that now when you were, it's kind of funny when you think back, right? It makes me happy to know that we bumped that up and you didn't meet with any real significant resistance.
Right.
And really guys, it's because the value, right? We bundled different features into this membership and positioned it really, I think this is super important. We positioned it as a way to help Carrie's clients continue to get the results that they want, right? Because, obviously in session, of course the sessions are great, they're super valuable, but a lot of the growth happens between sessions, right? So I think that's a really important point to note as well here. So really the positioning is key. We'll dig a little bit more into that as well. So basically, Carrie, we're priced at 97 a month, right?
Mhm.
Okay, awesome. And then tell us a little bit about how time consuming it is.
Well, the good news is that it's not really time consuming at all, which is the best part of it. And so, since I'm reviewing those logs weekly, I have about anywhere usually between 15 to 20 people enrolled per month.
Mhm.
And so with that, it's usually honestly maybe an hour total, hour and a half, depending on how much that those clients need that week. But really it's not a whole lot of time at all. So it's saving me, lots of time, getting a lot of bang for my buck kind of concept.
Yeah, and I do remember you and I talking about like batching this task, right?
Mhm.
So are you still able to do that?
Yeah, so I can set aside time. Basically, what I do is on most Fridays in the morning, I block that time to go in to review the food logs and send recommendations. I find that day is probably the best because if I'm going to send recommendations through, most people shop on the weekends. So that way I can send meal ideas or tips to, for success for the next week.
Okay, great. So yeah, I do think having some, I don't know, shall we say boundaries in place when it comes to, I think that's really important. So I do want to be clear to everyone that you're not saying, oh, every time someone puts a morsel of food in their mouths and, logs it, like you're going in and making comments. It's not like that, right? It's basically, once a week, she'll sit down and review the food logs and give helpful comments, that kind of thing. So that part we can kind of put into like an hour, 90-minute max time frame, right?
Yeah.
So, all right. So that's that part. You can, I would assume you can automate those like motivational and inspirational messages, right?
Yes.
Okay.
Yep. So that's, so you can really make it, generic to all disease states, some kind of motivational thing for the week. Or, if I have some clients that I know that are low FODMAP, so I'll send them a recipe for that disease state. And that, and that can help too. So you can kind of stratify like, okay, who has what type of conditions and what kind of meal ideas can you send them? Or some people will message me too, like, hey, I'm looking for some crock pot meals this week because I'm going to be out of town. Can you help me find some ideas?
Okay.
Or I can show them how to search for ideas too.
Okay, that's great. And that's inside the Eat Love platform.
Yes.
Okay, awesome. So, all right. So basically then you're not spending really any significant amount of time inside the platform creating meal plans, right?
Right.
You can go in and so up front, I think you need to assign a diet prescription, right?
Correct.
Okay. I think I don't want to misspeak here, but I think they might have a new feature where if it's like more of a general healthy diet, you may not even have to do that.
I haven't seen that part yet. I guess maybe because I'm doing more.
Yeah, like really intense. And honestly, most people here on this call are doing therapeutic diets. So in that case, you would have to go in and assign, create the diet RX, right? And then pretty much you turn it over to the patient.
Yeah. And it only takes, to put in that nutrition prescription, it takes probably less than 10 minutes, really. Okay. And so, I mean, because you had to put in the anthropometrics and, and the nutrients, which it's kind of self-driven there too. And so, yeah, it's pretty quick, even just to send through, create the first meal plan. It self-populates based on the prescription that you create. So that's not even time consuming. I mean, I save I don't know if anybody's made personal meal plans before, but it's hours and hours of work that you save just by using a platform that creates meal plans.
If anyone is still doing that, we need to talk. That is not a good use of your time, for sure. Oh my goodness. And that reminds me, there's one thing that I did want to just kind of elaborate on a little bit. And Carrie, you actually mentioned this. People are asking for meal plans. They want meal plans. Mm-hmm. I really feel strongly that we need to deliver meal plans, right?
Yes.
In the work that we do. And and it just makes sense. It really does need to be part of our services. So guys, if you're in a cash model, many of my clients are in the cash model. And what we do is we roll in the meal plans, we roll it into their signature program, like their main offer, right? And then the really cool thing, again, if you're in the cash model, when you can keep a really important concept, guys, is retention, right? Being able to retain, and I guess another way to say it would be, once you get your clients and patients well, we want to keep them on a maintenance program, for a really long time. We want to continue to serve people. Like there's a whole bunch of studies that, they talk about how it's so much more cost effective to retain clients and keep them over, I mean, a lifetime versus always having to go out and find new clients. It's a really, really important business concept. And I think having a membership program where you're integrating meal planning is such a great way to do it. So even if you've got like a cash model and you've got a signature program, let's say hypothetically that, you know, after 6 months or whatever, your patient or client maybe doesn't need in-person sessions anymore. You know, just hypothetically, you can step them down to a maintenance program that includes some of the things that Carrie's talking about. And I just think that is an amazing strategy that enables you to continue to serve those people over a long period of time. So, okay, let's get into, all right, let's talk about the selling process, shall we?
Yeah.
Because that's a really important topic too. And, you know, my hunch is that is probably something that is, you know, probably hindering some people is my guess. Oh, and guys, by the way, I think you can see the comment I posted. I did. Oh yeah, I think it does show. Yep. Okay. It showed. I just wanted to give you the link. If you're interested in signing up for Eat Love, use the link that I posted and you can get a $50 credit with an annual membership and a $25 credit with a quarterly membership. So just wanted to make sure that you all saw that. So, all right. So how do you sell? First of all, how many people do you have in?
Yes. So I have currently 15 people enrolled in the program. And again, it can fluctuate between usually 15 to 20 on average that I have per month.
Okay.
And that. So, and then as far as how do I sell, you know, I think that probably held me back the most, you know, that I felt nervous or unnatural about it. But the good thing is that it really sells itself. And so when I'm working through, their initial consultation, usually, and we're doing the dietary recall, I'm recognizing if it's somebody that does enjoy cooking or is wanting to prepare more meals at home. And a lot of people just, you'll hear in their talks, like, I'm just confused on what to eat. I don't understand what my needs are. So I look for, you know, cues that, okay, this person might be interested in a meal plan.
Right.
And especially dealing with complicated issues, therapeutic diets, a lot of people want more guidance to succeed. And so when we start the goal making process at the end of the initial consultation, I might say, are you interested in meal planning, or, you know, what are you looking for, kind of thing to start? And a lot of them are just like, I just need help on deciding what to eat.
Okay.
And so I just listen for those verbal cues, and I'll mention like, hey, I do have a meal planning program that I put in your nutrition prescription that really takes that guesswork out of meal planning for you. And it's all within your prescription. So you don't even have to think about it, you know? So, and then I'll say, would you like to see it? So that way you can decide if that's something for you. And so I'll do a demo, and I do in person. I also do telehealth. And so I either share my screen on telehealth, or I'll turn my laptop around for in person, and I'll show them the platform and how it works. And most people are like, oh my gosh, this is amazing. This is exactly what I'm looking for. And then once I kind of rope them in and get their interest, and then I'll say like, hey, this is really what you need to succeed in between sessions. This is part of my accountability program. Unfortunately, you know, insurance doesn't cover this. This is what, but this is what you get. And the work happens in between sessions, and it really does sell itself.
I love that. Yeah. So do you, I don't know, do you run into resistance? Like what are some of the, maybe the challenges that pop up? And by the way, before you answer that, I just want to comment real quick so I don't forget. Love the idea of doing a screen share. Just wanted to mention that, guys. I think that's brilliant. So I really highly recommend that, because, you know, you can you can tell someone about an application, but it's so much more powerful to show them. And clearly that it sounds like once Carrie does that, it really helps them to conceptualize how robust the platform is and how much it can really help. So do you run into objections and resistance?
I mean, sometimes I do. One that stands out forefront in my mind is I did meet with a teenager yesterday. And so obviously he's not doing the meal planning or the cooking. And so they have to go take it back to mom or dad who does all the prep to see if that's something they're willing to do. So that was, tricky. If they're not the ones doing the cooking or preparing themselves, you really need that support person involved. Sometimes a lot of those people will come to the sessions, as well and listen in. So then that way that's helpful. Because I do have clients where their support person is the chef. And so making sure they're part of that conversation is really important. Sometimes I have resistance on price, but that's a rarity. If so, they might say, hey, can I try it for one month or 2 months to just get started? And I do have some people that say that, but they're still on it 4 months later.
Yeah. So once they get a sense of the platform, it's like, oh my God, this is great. I don't want to.
And there are some people that, we all know those clients that are not really big, they don't really like to cook, or they feel really good about their breakfast or something like that, one meal during the day. And so that platform can be really overwhelming if you show all the meals for the whole week. And so they want it broken down, which, Eat Love is great because you can make it so that way it's, either simple meals, beginner level, things like that. So I kind of, I've made the mistake sometimes showing them the full platform for those people.
Oh, okay.
So I just need to remind myself sometimes, be like, hey, just show them the beginner side or, so that way it's not so overwhelming.
Oh, right. For them. Because if it's overwhelming, that can be an issue.
Yeah.
So, and guys, bear with me for 1 second. I'm going to copy and paste the link. Thanks, Ashley, for letting me know that you don't see the link. Let me repost that. And then someone did ask about the price for Eat Love. And, I would recommend that you reach out to the Eat Love team to answer some of those questions for you. Unless, Carrie, can you answer that?
Yeah, I'm on the annual membership, and I know it's coming up I think it's next month that I renew, so I don't remember. It's been a year since I looked.
Okay, yeah.
Yeah, but they have different pricing tiers. So, and you can get a free trial, I think it's for a week or two to play around with it.
So I have spoken with the Eat Love team, and again, I don't work for Eat Love, so I'm not like intimate in terms of like, kind of all the back end stuff that they're doing, but I know they're doing a ton. And then the one thing that I thought was super, super incredible that they are now doing is, and Carrie, you might not even know about this, but it's incredible. So you can now sign up, like your trial membership is different now. It extends beyond 2 weeks. Basically, the way I understand it is you get 2 free seats for the trial membership, right? Does that make sense? So instead of it being like 2 weeks, like it always was before, they changed it so that and here's really why this is so cool, is essentially you can roll out your membership program and you can literally make the money up front to pay for your membership, right? Instead of vice versa. So you get 2 free seats. So I think that's a pretty, and I just texted them this morning just to double check on that. And it's so basically the response I got was that all you have to do is sign up, use my link, And then you should be good to go in terms of getting those 2 free seats. So I would assume you can use one for yourself, one for a patient, or both for patients. Again, start to generate revenue using the platform. And then when it comes time for your third person, that's when you would, decide what membership level you want. So hopefully that helps. Let's see if we've got, yeah. Okay, good deal. So we have some questions coming in, Carrie. This is such great information. How long do people usually stay?
Yeah, that's a great question. I would say on average, probably about 3 months, because especially if we're following the low FODMAP protocol, it's if we can get through it all in a timely manner. Everybody's now out and about, so we might push it back longer, but that's about 3 months from FODMAP doing the elimination phase to the personalization phase. Or, sometimes I have people on it a lot longer. Like if I have people on it 6 to 8 months, just because I really enjoy the meal plans. And then, like I said, there's occasionally a couple people that just want 1 month. So for example, I had a chef who was confident on what he needed to eat, but then he's like, okay, I just don't know what to make. Can I have the meal plan for 1 month? So it's really individualized, but I would say on average, at least 3 months.
Okay, absolutely. Okay, so that's great. So you've got an average, you kind of are averaging between 15 and 20 clients pretty much throughout, right? It's consistently 15 to 20. So, we're looking at 1,500 to 2K per month in this model. Yep. It doesn't sound like it's very time consuming, right?
No.
Clearly it's not time consuming to deliver. It doesn't sound like it's hard to sell, right? Yeah. Right? So there's no drawback. The thing that I love, again, I'm such a fan of these membership models, is that you get to continue to serve your clients over an elongated period of time. Right. And, of course, I'm always looking at the business perspective. There's so much data to support the idea that, you don't always want to feel like you're on the hamster wheel constantly seeking out new patients and clients. Really, a stable business is really good at retaining clients and finding new ways to serve people over a really long period of time. Seriously. So I really want to emphasize that as just such an integral strategy within the business, your business model. So guys, if you're not doing this yet, hopefully this, what we've talked about today has really inspired you to take some action. There's really nothing to lose, right? And Carrie, I remember when we rolled this out, it was kind of like, let's just try it. Right? Yeah. We've got nothing to lose. Let's just try it. And really I would say, and this really speaks to that sales conversation. And by the way, I do have a little bit I want to share about that too. But you just really want to be cognizant of positioning this program as a way to provide additional support. And I really would emphasize that because we all know a lot of the growth does happen in between. There's only so much you can do in that, 30, 45, 60-minute time frame. And, the patient leaves, they've got questions, things come up, they're going about their lives. And this is just such a great way for you to provide that additional support with boundaries, right?
Right.
So we're never saying oh, I'm available, 24/7, text me. No, we're not talking about that, right? So we definitely want to put those boundaries in place. Do you ever have issues with that, Carrie?
So what I personally had issues with it. I was not good at first setting boundaries. I just would respond to people right away. And I would even have clients say to me, Carrie, you don't have to respond right now. You can by just putting that message out there. And so and to be honest, it doesn't have to be pretty and perfect to start. I just have one one form that describes the program and then an agreement letter and that they sign. And on that agreement letter, I state the hours that I will respond.
Yeah.
But basically, bottom line, same as like my right with the rest of my practice, I'll get back to within 24 hours on a business day or the next business day. So I'm really trying myself to set those boundaries to be, hey, you should not be working late at night or on the weekends too. So that's on me. But I do put that in the agreement letter that say, hey, you can communicate with me between 9 to 5, Monday through Friday.
Yep, definitely. I love that. So guys, anyone listening, like boundaries are so important anyway, right? And I really feel like a lot of our clients, I mean, we model healthy boundaries, right? So you really want to be cognizant of that. So I really would try to resist the urge, because I know it's strong, to, instantly respond to everything. Really try to, stand firm with your own boundaries so that you can model those for your clients and patients as well. Super important. So we do have a few more questions coming in. And there's a question about the price. Yeah. So yeah, can you ballpark I mean, here's my memory. Like, guys, I haven't looked at their website in a while. I think, don't quote me on this. Okay, do not quote me on this. I'm going by memory, which is a little sketchy. It can be sketchy. I want to say around 600 a year for like the entry level membership. Does that sound right to you?
I think that's about right.
Okay.
Because I bumped up to the intermediate level because I do another membership or like a group program where I have people in it. But yeah, because I think the entry level you can have up to 20, I think.
Okay.
It's been a minute.
Yeah. Gotcha. Yeah. So
yeah. I would reach out to them just to confirm.
But I mean, that should give you a ballpark. So, and so I think it's, it's affordable for sure. And especially, again, I love the idea that you can have two people, you can basically utilize two seats before you have to make that purchasing decision. I think that was brilliant. A couple other questions. So how do you handle the billing for the membership?
Yes. So for the billing, I have a program set up and I use Healthy, and I think like Simple Practice can do a similar thing, but I build out a package in Healthy and I just say, hey, have a continuous monthly subscription set up to charge $97 a month. And so it's ongoing. And I will only stop it if the client reaches out to me. So my agreement letter, I use strong language to say, when you're completed with this program, you need to send me a direct message, or maybe during a follow-up session, we might see that, hey, they're kind of on cruise control here. It's a good time to end the membership. And so I just make sure that they know that, hey, you need to reach out to me to end that membership.
Okay. Gotcha. Which actually brings us to another question. And that is, hey, Eileen, how do you manage resistance when they want to stop? Is there a strategy? Like, do you just, say, okay, that sounds good? Or do you try to not talk them out of it? We're never, ever talking someone out of a decision ever. But I mean, are there cases when you don't believe it's in their best interest to quit, or do you tell us a little bit about how that goes?
Yeah, I'm trying to think, Eileen, that's a great question. And I'm trying to think of an experience if I've had, I guess more so, I guess some clients that I had more of the resistance was probably like weight management clients where they felt, I don't know. I guess it seems to me they weren't really motivated to begin with. Is really where they were looking for something, but it was too much work. They wanted something done for them. So usually, I mean, as a dietitian, I'm going to help them. I want it to be a tool that is going to benefit them. And so those that were more resistant were probably people that weren't comfortable in the kitchen or preparing as much meals as what that program did. And so if that's something, then there's like another bubble of people I feel like I'll see that they want meals that are already there for them. That they just click the button, they order meals and it's done, it's cooked for them. And so we'll talk about, different tools to help them succeed that way. But that's like a rare person I feel like I'll see. But most of the time it's people that are ready to come off of it. Be honest, they feel good about their meals that they're making. They have an awareness of how the nutrients should be balanced together. And so we'll have a conversation like, no, you do seem like you're preparing good, healthy meals now. If you feel like you have enough tools in your tool belt, let's just stop that membership if you're not using it.
Right.
I think they appreciate me when I'm not giving them resistance back, that the rapport is still there. That's, the key thing is that I don't want to feel pushy that they need to stay in it if they're not really wanting to or seeing the success that they need, or if they're already kind of like in maintenance with it.
Okay. So what about, so obviously you've got these other components, right? Like the food log feedback and the inspirational messaging and the ability to ask questions. All of those things are pretty significant. Do you ever find that, people continue to need, like, it's still in a bundle, right?
Right.
I wonder if, like, even people that maybe feel like, okay, I've got my meals under control. Are there people that maybe stay in because of the other, the other features of the program? So
yes.
The ability to ask you questions and things like that.
Yeah. So we'll still, for a lot of people, because I've had some people that are confident in their kitchen and they just wanted some other ideas. And so if they're still, if we're still working together, collaborating together, they'll stay in it with me and have one-on-one sessions still, which is great. And then I do have some people that will still keep a food log, but I'm not looking at them like I am with the membership program, because I know that you can, it could be a lot. So usually what I do for those that still want to keep a food log, like 5 minutes before I meet with them, I quickly look through the food log and I talk about it during their session, but I'm not using my personal time to review their logs like I was within the membership. So again, like Leslie was saying, boundaries. Otherwise, it could be a lot of time on my personal time that I'm not getting paid for.
Right. Yeah. You want to be really careful about that. Okay. So, all right, guys, before we wrap up, I just want to remind you about a couple of other things, a little bit off topic, but always connected. I do want to remind you all that my course called Consultations That Convert is open. The doors are open. And here we go. I've got the URL listed, nice and easy to remember. Guys, this is an amazing class. If you at all are struggling with really nailing your discovery calls and your sales process, I really want to encourage you to take a look at Consultations That Convert. We've got the early bird pricing good until midnight on Monday. Okay, so definitely the clock is ticking. And if there's all kinds of reasons I could, share with you to really sign up for the course. But I do want to emphasize this was truly a game changer for me personally. And that's why I created the course. The idea is, you get leads from all different avenues, right? Like so many people are spending time on Instagram and really, really working hard to generate leads. And the idea here is that, of course, you all know all of this converges upon your ability to seal the deal in that enrollment conversation or that initial consultation. So I give you word for word scripts, like we go really deep, how to handle objections, a lot of support. So just want to remind you about that. And then the other thing I want to remind you about is I am doing a complimentary coaching call on Monday. All right, guys. So this is going to be a free group coaching call. So I wanted to make sure that you all know about that so you can mark your calendars. And my wonderful Abby, if Abby, you could put that link. It doesn't even require an opt-in. Okay. Just want you to show up, share with your friends, just show up. And that way we can do some coaching. I did see a question about the pros and cons of posting your rate online. And so that is the kind of question that we'll delve into on the call on Monday. All right. So Abby's gonna, yep. All right. So wonderful. Abby is posting that link. So be sure to mark your calendars, copy and paste that link. No opt-in necessary. Just click the link and show up. And we'll have a lot of fun in a Zoom call. All right. So let's go ahead and wrap up. Time flies, right, Carrie?
It does. Yeah.
This has been so incredible. Is there anything else you want to add?
I just say, as dietitians, we are perfectionists. And so,
yes,
go do it scared, right? You do not have to be perfect at this. Just do it. All I had to do was create an agreement form and have that meal plan ready. And then I just did it. It doesn't have to be anything fancy or a lot of time. Just, go set your price, get an agreement form, and then start. You have nothing to lose.
You have nothing to lose. Absolutely nothing. And a lot to gain, of course, in terms of revenue and really being able to serve your clients on a much deeper level. And at the end of the day, that's what we're all here for, right? Is to really support our clients so that they get the results that they desire. And I love this idea. It's a win-win all the way around. So awesome. Sounds good. Thank you so very much, Carrie. This was incredibly valuable. I know we hit a nerve with all the comments and questions. I even had, like I told you before we went live, I've had people reaching out, they love this topic. So really, really super appreciative that you're just your willingness to jump online with me and share your experience with other practitioners. So thank you so much.
Yeah, thanks for having me.
You bet. Anytime. We'll have to do it again. I know we've done it a few times now, and it's because it's such a great topic. So, okay, guys, sounds good. So thanks for joining us today. Again, I hope that you will kind of spread the word and join me for that live coaching call on Monday. Abby posted the link. It's kind of a long link, so probably your best bet is to copy and paste. And you'll be getting, if you're on my email list, you'll be getting email reminders about it. You'll probably see it on social media, but just mark your calendars for Monday at 7 p.m. Central. Okay, so Monday, 7 p.m. Central, copy and paste the link, put it in your calendar, and I can't wait to see you there. All right, guys, so have a great rest of your week. And thanks again, Carrie.
Yeah, thank you.
Had a great time chatting with you. I hope you guys have a wonderful week and weekend, and I'll see you Monday. Bye for now.